The key risk factor for predicting cardiovascular disease is cholesterol, right? Well, many studies are now challenging that view. In fact, there's one test, and it's not a blood test, that the research papers consistently label as the single best predictor of cardiovascular disease. Now, I order this test quite a bit, but even I was shocked when I came across this new research paper that absolutely blows the lid off of assessing cardiovascular disease risk. In fact, this one test was found to be a better predictor of heart attacks and strokes than 19 other blood tests combined, including cholesterol, LDL, and more. This test is called the Coronary Artery Calcium score, or the CAC. And in my opinion, everyone over the age of 50 should be getting one. It's fast, it's inexpensive, and it could literally save your life or stop you from taking a medication that you don't need. So, if you've never had a coronary artery calcium score, if you've never heard of it, you absolutely need to watch this video. And this is not clickbait. This is about a very real and meaningful test that could change the entire picture of your health. So what is the coronary artery calcium score? Well, it's a quick and inexpensive CT scan of your heart, right? It tells us how much calcified plaque is in the arteries of the heart. Now, like I said, I've been ordering coronary artery calcium scores for years now. And honestly, I thought I understood how useful it was, how important it was. But as I said, there are many, many studies that have called the CAC the single best predictor of future cardiovascular disease and coronary heart disease. So I ordered them quite a bit. But then I came across this 2024 study that absolutely blew me away. But it made me stop and think, it's not just about how I practice, it's about how backwards our whole approach to heart disease prevention really is. And this wasn't some fringe article. It was published in Atherosclerosis Plus, which is a well-respected peer-reviewed journal. So they looked at over 1,200 men and women, all without diagnosed cardiovascular disease, and they followed them over 10 years to see who would go on to have heart attacks, strokes, or other major cardiovascular events. So what the researchers did was really simple. They took 19 different blood markers and risk tools, and they looked at things like lipids, right? Like triglycerides, HDL, LDL, total cholesterol. They looked at kidney function, like the eGFR, cystatin C. They looked at inflammatory markers like CRP. They looked at calcium phosphate metabolism, troponin, and even something called the SCORE2, which is Europe's version of sort of like a risk calculator based on age, sex, BMI, smoking, and blood work. And the researchers asked, how well do these 19 markers predict future cardiovascular events? Then they compared it to just one thing, the coronary artery calcium score. And here's the shocking part. The coronary artery calcium score alone outperformed all 19 other markers. But it didn't just outperform them individually, it outperformed the predictive power of all of those other tests combined. Not just as good, not almost as good, better. Full stop. So what does that mean for you? Well, it means we've been focusing on the wrong numbers. It means people are being put on statins, or in other cases, not being on statins, based on their lab results, right? Their blood work, when we should be looking at the actual plaque. Because that's what the CAC, right? The coronary artery calcium score, that's what it actually shows you. Actual hard plaque inside the arteries of the heart. And I've seen this play out with my own patients. I've had people in their 50s with zero traditional risk factors, right? No high blood pressure, cholesterol is normal, no family history, they eat right, they exercise, and their coronary artery calcium score comes back at over 800, which I know you don't know what that necessarily means, but it's very high. And on the other hand, I've had people with multiple risk factors, right? Diabetes, overweight, family history, high cholesterol, and I order a coronary artery calcium score and it comes back at 0. And that's what we call the power of 0. Because here's the best part. A coronary artery calcium score of 0 doesn't just mean low risk. It might mean that you don't need a statin at all. And this isn't just my opinion. According to the American Academy of Family Physicians, if the coronary artery calcium score is 0, statin therapy can be withheld or delayed unless the patient is a cigarette smoker, has diabetes, or a strong family history of premature atherosclerotic cardiovascular disease. And I've had patients that were put on statins just because their cholesterol was high. But after they get a coronary artery calcium score of 0 and they review the guidelines with their prescribing doctor, they had a real conversation, and in some cases, they come off their statin. To drive that point home, in that Schaefer study that I outlined at the beginning of this video, they compared the risk assessment tools versus the coronary artery calcium score, and only about 1% of the people were labeled as low risk by the standard risk calculator. So in other words, 98% of them were labeled as moderate or high risk, which may mean that they get put on statins. But when they got the coronary artery calcium score, 55% of them, over half, had a 0 score on their coronary artery calcium score. In other words, no calcified plaque. And that means their actual risk of a heart attack was very, very low. However, the risk assessment calculator would have maybe put them on medication. But the scan said, you're okay for now. And in fact, when they added the coronary artery calcium score to the existing risk calculator, it reclassified 63% of the people into more accurate risk categories. So that's not just a little tweak, that's massive, right? And that's people getting the right treatment or avoiding unnecessary treatment. And here's why this is so powerful and hopeful. We live in a time where people are being prescribed more medications than ever, right? Statins are just given out routinely, often based on just cholesterol numbers alone. But this test gives you something most blood work cannot: real-world reassurance. So if your coronary artery calcium score is 0, your arteries are clear of calcified plaque. And that's the real disease that we're trying to prevent. So while some people may need statins, many others may not. And this test can open the door to thoughtful, evidence-based de-prescribing. Now that's a conversation worth having. And in my experience, the conversation does not happen unless you know your coronary artery calcium score. Now, on the other hand, a high coronary artery calcium score, even if your cholesterol is normal, could mean you're at real risk. And in that case, a statin would make sense. And this is where I believe the coronary artery calcium score should be the primary deciding factor for starting or stopping statin therapy. Not cholesterol, not age, not some outdated calculator. But of course, that's not the consensus view, and I'm not a medical doctor, right? I'm a functional medicine clinician and a chiropractor. So I'm not here to tell you what to do. I'm here to show you the evidence and invite you to take this test seriously. Now, I hear this a lot when I'm trying to encourage someone to get a coronary artery calcium score, right? When I'm trying to order a CAC test, they say, well, even if my CAC score is high, what can I do? I can't get rid of calcified plaque, right? So I'd rather not know. And that's true. You cannot sort of reverse the calcification. But here's the important part. You can absolutely reduce your risk of a heart attack or stroke because you know your coronary artery calcium score. Let me give you some examples. According to this study, in people with high blood pressure and a CAC score of 0, 99 of them need to be treated with blood pressure lowering medication to stop one cardiovascular event like a stroke or a heart attack. However, in people with high blood pressure and a CAC greater than 100, only 24 need to be treated to stop a stroke or a heart attack. Now, some people with high blood pressure and a CAC of 0 might second guess taking blood pressure medication when the odds of it doing any benefit for them is 1 out of 99. But if it's 1 out of 24, they may think about taking those meds after all, right? And on the same line of thinking, what if someone told you you had to take an aspirin every day? You might have read recently that it's not worth it due to GI bleeding and other side effects. However, this study showed that in those people with a CAC score greater than 100, the odds ratio for a heart attack dropped from 3 to 0.56 with aspirin use, meaning aspirin was associated with an 82% lower odds of having a heart attack in this high-risk group. Now lastly, let's look at statins. In people with various risk factors like high cholesterol, 100 people with a CAC of 0 need to be treated to prevent one non-fatal heart attack. However, if their coronary artery calcium score is greater than 100, only 12 people need to take statins to prevent one non-fatal heart attack. And of course, lifestyle changes like diet, exercise, stress, sleep, they all play an important role too. And you may take that more seriously if you've had a coronary artery calcium score that shows that you have some plaque, right? So we can't chisel away the plaque, right? but we can stabilize it, we can reduce inflammation, and most importantly, we can reduce the odds of a cardiovascular event from happening in the first place. So now you may be wondering what a coronary artery calcium score actually is. Well, it's a CT scan of your heart, and it shows calcified plaque in the blood vessels of the heart, what are called the coronary arteries, right? So in other words, it takes a look at the real disease, not a guess based on blood work. And you may also be wondering, why hasn't my doctor ordered one of these before he put me on statins? It must be really expensive, right? Well, actually, it's about $99. Well, it must take a long time to do. Yeah, about 10 minutes. So why hasn't your doctor ordered one? I don't know. That's a question for your doctor. But what do you do with all this information? Well, it's simple. If you're over 50 or you're younger with a family history or various risk factors, get a coronary artery calcium score. It's quick, it's painless, it's a CT, it costs maybe $100, right? And it could change how you understand your risk or possibly save your life. So we already screen for cancers with like mammograms and colonoscopies and prostate exams, but heart disease kills more people than all cancers combined. And yet the best screening test we have, the coronary artery calcium score, is still vastly underused. That needs to change. So talk to your doctor, ask for a coronary artery calcium score, or call my office, see if we can order one for you. And if your score is 0, it might just help you avoid a lifetime of medications that you don't need. So don't let a 10-minute test stand between you and the truth about your arteries. Ask for a coronary artery calcium score. It might just change your future or your prescription.